So right now we're going to talk about all the stretches that we can do with a ball, and the ball that you choose has to have a give. If it doesn't have a give, it's not the right ball to use. So I like the ball that has air in it and it's firm but not too hard, because it's not going to be good. So you can use this ball, and many of you have gotten this ball from us, anywhere in your body. So I'm going to show you a few of the things that you can use to help you, okay? So one of the things, this is the most nice spot, upper trap trigger point. Many of you has upper trap trigger point. So you find the trigger point and you just kind of lean on it and you just relax here and you wait for 2 to 5 minutes for this trigger point to just let go. So you just wait, you hang out, breathe, and if you feel like a lot of pain there, bring your attention to that point, and every time you exhale, let go. You just have to tell your mind to let go and the muscle will let go. So ideally you should hold this for 2 to 5 minutes, and I am not going to hold it for 2 to 5 minutes because of the time constraint, but you should do that at home. Another very good spot for the ball would be over here, right underneath the axilla or the armpit. So this is the spot that many people have pain in. So you could just kind of lean on it and just relax. Hang out there and chill and just wait. Wait for 2 minutes. Make sure you have a timer on so you're at least staying there for 2 to 5 minutes. Okay? And breathe. So this is a good area to use it at. Another good area is your pecs. I'm going to take my glasses off just because I don't want it to drop. So your pecs, many people have tightness in their pecs. So this is where your pec muscle is, and the ball should be right at that muscle. And you just kind of lean into it and relax. And sometimes I like to roll and find the most tender spot, and that's where I feel it. So I'll just hold it there and just wait for 2 to 5 minutes. The reason why the time element is so important is because the fascia does not release, it just starts to release at 2 minutes. So it goes from 2 to 5 minutes. So you have to really hold it for a long time for the fascia to release. And then once that release happens, the fascia is more permanent than a muscle releases. Okay, so you just kind of find different parts of the pectoral muscle and just stay there till it releases. So, and many people have pain like right here in between the scapula. So you could kind of use the ball and find the spot anywhere in here on the top or near the scapula right here, and find the most tender spot and just stay there for as long as you can. Only one thing, I do not want you to roll on the spine. You have to stay away from the vertebral column because I don't want anything moving the spine. It's supposed to be next to the spine, not on the spine. So that's another point that you can use. A very good point is right here. I am not on the spine, but I am next to the spine. Okay, and I'm just using this. Feels so good to just hang out here for a little bit. Now I'm going to also, another precaution is if you have osteopenia or osteoporosis, do not do this because it is on your rib and I don't want your rib getting hurt. Okay, so don't do that. So you just find the spot and you just hang out for 2 minutes or 5 minutes, whatever time you need. Okay, so that's for your QL. And the next point that I really like, and this is really good for somebody that has hip bursitis. Know where your hip joint is. The hip joint is here. It's not here. Feel that bone. You cannot put the ball on the hip joint. It has to be above it. So this is where the tensor fascia lata is, which is the muscular portion of the ITB. So you can hang out, find that spot, and usually you would have pain. You would have pain there, and I have pain there right now. Actually enjoying this stretch. So you just hold it there and wait for 2 to 5 minutes. Okay? And that's for your tensor fascia lata. And now we'll do the sitting one. So I need a chair. Let me go get the stool. So this is another way of doing it for your upper back. So you could be sitting in a chair and you could just kind of find the spot. I mean, I would highly recommend a chair that doesn't move, not a stool that I'm sitting on. So you find the spot anywhere where there is any restriction, and then stay in that position for a while, for 2 to 5 minutes. Another way of doing is sitting is piriformis. So you're going to find the spot on your butt or your piriformis, and you're going to roll on it till you find the most tender spot, and you're going to stay there for 2 to 5 minutes. And you could ideally do this on both sides, so you're not shifting, you're not crooked. So you could do it this way on both piriformis at the same time. And everything has to be held for 2 to 5 minutes. The next one that I would like you to do is for the feet. This is a great stretch for somebody that has plantar fasciitis. So you find the little spots on your foot and find the most tender spot and just stay there. Stay there for 2 to 5 minutes. A variation to this would be if you have a plastic bottle, fill vodka in it and put it in the freezer. The vodka doesn't freeze as hard as water does, and it is gelatinous. So you could actually take that bottle and put it down, and so it will serve as both icing it as well as stretching it. So you could do it, work on your foot, and whenever you find that hard tender spot, you need to wait there for 2 to 5 minutes. All right, let's